maybe now I think at that time though we didn't have any understanding of what better could have been done. We were just focused on getting through the first year at that point of time. But now I understand that there could be something else that we can do to improve our scope of application of pharmacy, one, and second, how do we integrate that with other departments so that the student gets a complete understanding of how we use a first year knowledge in final year, or how we use a first year knowledge in second year when it comes to pathology, etc., etc. Being a clinician, I'll present with a clinical problem that we face. So I want all of us, you, to help me out to understand how we can do better. As I said, I'm not here to teach anything about pharmacy. It's not my subject at all. But I want all of us to understand how we can integrate this so that we can take this forward. We will have two sessions, as one first part would be dealing with a certain theme, and the second part will deal with the certain theme. We will have a breakout sessions in between where I will we'll group out people together, got some reading material. You can engage with that reading material and come up and present your understanding of what is happening in the pharmaceutical. So we'll have two breakout sessions, and we'll have group discussions after the breakout session for us to interact on what is happening. Normally, as clinicians, we face one theme for us to understand how one theme can itself give us this kind of an opportunity. Now, a homeopathic clinician receives all these kind of cardiac cases. As you become senior, you get more and more of these. So people coming with microvascular anginas where there is nothing much to offer in modern medicine usually come. Then post CABG, again when patients develop symptoms, once they're operated once, but they develop symptom again, and they do come to you again for treatment and management. When they experience angina post CABG, 5-6 साल अच्छे निकल जाते हैं, उसके बाद में फिर सिम्टम्स आते हैं, तो उनके पास दूसरा कोई चारा नहीं बचता, तो आ जाते हैं. People come when they are diagnosed as microvascular angina, because there is nothing much to do in modern medicine apart from prescribing the blood thinners for microvascular anginas. People who have been diagnosed as something like Prince yeah. Thank you. This is the report published by CAM, which says that patients with progressive primary myocardial diseases with diminishing poor response to modern medicine like cardiomyopathy usually resort to homeopathy. Patients with recurrence of symptoms post PTCA, PCTA and CABG come back to homeopathy. Patients who have refused surgical intervention after it has been indicated and offered as main line of treatment come to homeopathy. Young hypertensive following cardiac event resorting to lifestyle modifications come to homeopathy, and patients wanting to undergo cardiac rehabilitation with primary and secondary prevention. This is typically what a homeopath sees. This is the stats of what homeopathic doctor sees in a hospital from a cardiac perspective. Cardiovascular OPD में ये percentage से आपके पास patients आते हैं. Now, I would take up this case for us to understand how we think and how knowledge of pharmacy could enhance our thinking process. So this is a case of a 52-year-old male who is a known asthmatic, was under homeopathic treatment with and was taking some inhalers, etc., etc., was working in the operation theatre as an assistant as an assistant in the theatre. Since last 4 or 5 hours, he had severe occipital headache chest discomfort, and grade 3 dyspnea. The blood pressure was 180 by 130, pulse was 100. He had all bilateral bronchi were there, and rest of the things were okay. The pupils, when we examined, both bilaterally were dilated. They were reacting to light, but they were dilated. There was T-wave inversion in 2-3 on AVF, which indicates inferior wall myocardial ischemia as well. Other things were quite okay. Their cholesterol was raised, but that had nothing to do with this particular event. But I'm just giving you the. He had taken Depin 5 mg 4 hourly, but no change in the blood pressure. Blood pressure was 170 by 190 systolic and 110 by 130. Restless, continuously. Now, this is a clinical scenario, but when we asked him what actually happened and what precipitated it, patient, so he's supposed to keep the operation theatre ready before the surgeon and the anesthetist walks into the theatre. So patient saw anesthetist arriving in the operation theatre for an emergency operation. The operation was of amputation of an infected foot due to Hansen's with cellulitis and maggots, and it was highly offensive when the patient came in and he had not kept the OT ready and the anesthetist has already arrived. So this is the situation which has triggered the entire event. Okay? So this is the homeopathic part of the history. We know the clinical part. He has an accelerated hypertension, his T-wave is inverted, and he's also precipitated asthma. But what triggered it, this is the triggering factor. He was not ready, so it was like he was taken by a surprise and there was a shock, like अरे अभी मुझे ये सब करना है. Or at the same time the patient had arrived and there was very bad smell that was there because he already had an infected foot with cellulitis, maggots, which were due to secondary to Hansen's. So this is the situation. Patient was shocked because of sudden arrival of anesthetist in the OT, and headache started since then, and there was very strong offensive odor which aggravated the headache. अब ये एक्चुअल सिचुएशन है और इसमें you don't have much time. If you can understand, there's very little time. He has already taken conventional treatment and that has not helped him. There's already T-wave inversion that has come up. So there's very little time left for you to think, sit down, discuss the full case with him and repertorize and prescribe, etc., etc. Now this is where I believe knowledge of pharmacy steps in very strongly. Okay, because this is not a very classic homeopathic scenario where people are sitting across table and taking cases for 30 minutes, 40 minutes, analyzing it, evaluating the symptoms, putting them in the order, repertorizing it, etc., etc. You need to be very quickly, you need to come to a conclusion very, very quickly and administer something which will help the patient. So this is actually the totality. Ailment from shock and surprise, aggravation from strong odor, sudden effects, occipital headache and hypertension. So we want to have a remedy which will cover all this, correct? सो ग्लोनाइन है, फेरनमेट है, जेल्सीनियम है, शॉक एंड सरप्राइज है करके कॉफिया है, सडन इफेक्ट्स है करके एकोनाइट है ना, नक्सवामिका है. तो अगर आप सिर्फ सिम्टम्स देखोगे तो आपको ये सारी चीजें दिखाई देती. द पॉइंट दैट आई एम ट्राइंग टू ड्राइव होम इज दैट वी रियली नीड टू गो बियॉन्ड द अंडरस्टैंडिंग ऑफ सिम्टम्स टू अंडरस्टैंड द एंटायर फिनोमेना. हुआ क्या है, सडन शॉक हुआ है और उसके बाद में हाइपरटेंशन ट्रिगर हुआ, एक्सेलरेटेड हाइपरटेंशन ट्रिगर ऑफ हुआ है, उसके सेकेंडरी इफेक्ट सब जगह पे दिख रहे। जलसीमियम भी आ सकता है, क्यों नहीं। अब पॉइंट ये है कि गेसवर्क करने के लिए हमारे पास कितना टाइम है और कितनी गलत दवाइयां हम दे सकते हैं। ऑस्टियोआर्थराइटिस में आपने एक गलत दवाई दी तो अगले हफ्ते चेंज कर सकते हो, है ना सर। बाल गिर रहे, मैं कितने सालों से दवा ले रहा हूं, बाल आ रहे जा रहे, ठीक है ना। तो ये जो एक्यूट कंपोनेंट है उसमें अंडरस्टैंड हाउ दिस फिनोमेना इज डेवलपिंग। एल्बम आया है 25th नंबर पे और विराट्रम विल्डी आया है 37th नंबर पे। ये सारी दवा आपको 3 मिनट में डिफरेंशिएट करनी है, 2-3 मिनट में। कॉफिया में odors become intolerable है, sudden rise of blood pressure is there, correct, and shocks and surprises is there in coffee, but coffee surprise is pleasant surprise. This is not a pleasant surprise. जलसीमियम आपको ऑक्सीपिटल हेडेक में मिल जाएगा, है ना, डलनेस डिजीनेस आ जाएगा, बट जलसीमियम का जो इवोल्यूशन है वो सडन नहीं है। जलसीमियम इवॉल्व्स ग्रेजुअली। आपको सडन रेमेडी चाहिए तो आपका जलसीमियम यहां फिट नहीं होगा। ग्लोनाइन में सडन रश ऑफ इंजेक्शंस स्पेशली टू रीसेट द ब्रेन, occipital headache, sudden violent effects and lung congested along with head congestion. अब मेरा ये सिम्टम्स आए कहां से, ये प्रूविंग में तो नहीं आएंगे सिम्टम। लंग कंजेस्टेड, ये प्रूविंग में तो कोई आके बोलेगा नहीं, हाँ सही है ना। डायलेटेड प्यूपिल्स आपको प्रूविंग में नहीं मिलेंगे, करेक्ट। It's a drug which was once used in allopathy, but they found out that there were a lot of side effects to this particular drug. So it would definitely bring down the blood pressure, definitely bring down the heart rate, definitely blood pressure, definitely bring down the heart rate, definitely have a calming effect. Also found out that it was not safe enough when used in crude form, and that is why the drug was discontinued.